Well, hello there. Today I'm going to talk to you about sugar. Now, people ask me sometimes, they say, Dr. McKenzie, why is sugar bad? Well, let's just talk about it and then you'll understand. So, in nature, let's just say you're eating an apple. An apple actually has sugar in it, of course, but it also has fiber and enzymes and vitamins and minerals and antioxidants and water. So, if we took everything away from that apple except for the sugar, let's just say we extracted the sugar and then we concentrated it, now we have a drug. So it's not the same anymore. In other words, in nature, it should have other things combined with it so that we can actually process it. So when we isolate it and concentrate it, it's a different thing now. And so, and sugar is actually more addictive than cocaine. So it's part of everyday life. It's part of every holiday. It's part of birthdays. I mean, it's part of all kinds of social functions. And so what we have to figure out is, if it's something that we should consume sometimes or should we consume it not at all. And it really ultimately depends on a person's health. So let's just talk about, what kind of problems does it cause, and if you have health problems, why you probably just want to avoid it. And so let's just talk about it. So when you have increased sugar intake, basically, or if you have large amounts of high glycemic index foods, then this is the different things that can happen. So one thing is that it creates inflammation. So when I talk about inflammation, I'm talking about increase in certain inflammatory cytokines, interleukin 1, interleukin 6, interleukin 10, tumor necrosis factor alpha, and NF-kappa beta, all of which are linked to different kinds of degenerative diseases. So these are diseases that we're not born with, but we develop them basically because of our lifestyle. The other thing that sugar does is that it also creates glycosylated end products, which are free radicals. And so when you take inflammation that's systemic, meaning your whole body, and you combine that with free radical damage plus time, it turns on any bad gene that you carry. So for example, let's just say that you carry what's called a proto-oncogene, which is a gene that has the ability to become cancer. If you put it into the environment of free radical damage and inflammation all the time, and you do that for enough time, so that's why age is a factor as well, then that can become so the proto-oncogene becomes an oncogene, and then over time those oncogenes become cancer. So in other words, the inflammation and the free radical damage allows for the cells to mutate, and then this mutation turns into cancer. So really, if you want to prevent cancer or other kinds of degenerative diseases, you don't want large amounts of sugar in your diet. And if you have practically any health problem, when you start cutting out sugar, you improve yourself a lot. So that's one of the best places to start. What's also interesting regarding cancer is that the GLUT4 pathway is fed on it's fed on sugar. So when you consume sugar, you feed the cancer even more. So one of the best things to do if you have cancer or pre-cancer, cut out sugar. It's a great thing to do for your health. So another thing is that increased amounts of sugar or high amounts of refined carbohydrates in your diet also creates insulin resistance. And how do you know if you have insulin resistance? Well, some people, you can't tell unless you look at their labs. But if you have an abdomen that's not flat and you're not a pregnant woman, then truthfully, you have insulin resistance, even if you're not a diabetic. So it's a sign that you're eating too much sugar in your diet. So it's a good idea to cut that out. But also it is linked to diabetes mellitus type 2, as well as PCOS. So women with PCOS, they have a hard time getting pregnant. And again, one of the best things you can do is just cut out sugar. High blood pressure is often linked also to high amounts of sugar. And we see dyslipidemia. Dyslipidemia is going to be where you have too much of the bad cholesterol, too much total cholesterol, too much triglycerides, and not enough of the good cholesterol. Also, we see cardiovascular diseases developing because of high amounts of refined carbohydrates, including, I'm going to add to that, sleep apnea. So sleep apnea, we know it's related to inflammation, but it's also linked to insulin resistance. That's why so many of the people that have it also have a protruding abdomen. Also, dementias, the risk goes way up with high amounts of refined carbohydrates. 70% of dementias are Alzheimer's. Sometimes Alzheimer's is called type 3 diabetes. Also, another thing that people get is syndrome X, or metabolic syndrome. This is where people are round. They have a very round physique. A lot of times they have thyroid issues. Along with that, they have high blood pressure. They might be a diabetic or a pre-diabetic. If it's a woman, a lot of times you see hirsutism, so they start having some facial hair. A lot of times they'll also have, other comorbidities like PCOS. Fatty liver. The fatty liver is a big deal because your liver has like 500 functions. You don't want a fatty liver. So you want your liver to work good, but some people have a fatty liver because they're alcoholics, but you can also just eat too much sugar because ultimately alcohol is just rotten sugar. So another thing that we should think about is dental hygiene. So if you don't brush your teeth often enough, or floss, and you have large amounts of refined carbohydrates in your diet, this can lead to gingivitis, and gingivitis is actually linked to rheumatoid arthritis. So it's very interesting how different kinds of pathogens can actually create molecular mimicry so that your body starts attacking its own tissue, such as in the case of rheumatoid arthritis. Also, large amounts of refined carbohydrates in your diet also decreases certain neurotransmitters that you need to have normal mood, so that you don't have things like depression and anxiety and insomnia and chronic pain, things like fibromyalgia. So, if you have too much, or let's just say you have dysregulated blood sugar, or if you have insulin resistance, it can lead to not enough dopamine. So a person can end up being depressed. A person can get bone pain. A person can know that they're loved, but they don't feel loved. It's a big deal. It also affects you academically if you don't have enough dopamine. So your grades in school will probably be declined as far as what you're capable of doing. So even if you're a good student, you'd be better if you had good amounts of dopamine, because you need that for your frontal lobe. Also serotonin. So serotonin, we see that with depression. Also it's linked with anxiety as well, but I think more with depression. And also with chronic pain and problems with getting to sleep. With acetylcholine, it's another neurotransmitter that's very important. You need it for your muscles to fire, so you can get muscle injuries more easily when you have problems with insulin resistance or high amounts of refined carbohydrates in your diet. Another one that we see is also that can affect your memory as well. And then we see GABA. GABA is very much dependent on the citric acid cycle, which is completely related to sugar intake. And we see anxiety with that. So a lot of the medications that people are taking for anxiety or depression are trying to recycle what you're not making. But wouldn't it just make sense to start making it? And that's a different approach, but I think it's a more novel approach. Also, if you have any kind of autoimmune disease of any kind, just add sugar if you want to make it worse, and if you don't want to put it in remission, and you want to develop other autoimmune diseases as well. So my conclusion would be that if a person's got fantastic labs, meaning they don't have too much inflammation, they don't have abnormal lipid panel, they don't have low blood sugar or high blood sugar or issues like that, I would say that, you know, if you want to eat a little bit of sugar every once in a while, no problem. For kids, if a child is obese, I don't recommend eating sugar. If a child is for the most part pretty healthy, let him have a piece of candy sometimes. But it shouldn't be something that they eat every day all the time. And a really good way to look at it for kids is give them berries. If they want something sweet, give them something that's sweet that doesn't create health problems. If you have any kind of issues like I just talked about, probably don't eat sugar. So, you know, don't buy it. Start looking at what you buy. Look at the label and see if they added sugar to it. And also, in the future, I'm going to talk about what are the high glycemic index foods, because when you have health problems, it's a good thing to start avoiding them. Some of them are actually pretty healthy foods, like bananas, for example. But you just shouldn't, if you have problems with insulin resistance, it's good to cut those out until you don't anymore, and then you can eat them sometimes. Some really good substitutes for sugar, and it's easier to get these nowadays. Stevia is a great one. You can actually get chocolate they use stevia to make it. You can get monk fruit, you can get xylitol, sucralose. These are all really good substitutes. One that I highly advise against is aspartame. It's worse than sugar. So, you know, sugar-free is not always good, especially if it's aspartame. So anyway, I hope that that's helpful for you. If you have these kinds of problems, you know, I recommend truly trying to change how you eat. And try not to go out to eat, because if you do, you don't know what's in the food. And you know, if you're going to go to somebody's house for a social function, don't be afraid to tell them, look, I'm working on my diet, I want to be healthier. So anyway, I think you should think of your food as your medicine, and this medicine, being your food, hopefully will prolong your life and improve the quality of your life, even, like I said, even mental health. So anyway, I hope that's helpful for you, and I'll catch you next time.